So imaging is very important. Besides for the patients, we call it the history. When someone comes to the doctor's office, we want to know the signs and the symptoms that you're having or that you're experiencing that would kind of guide us down the road of ordering any number of different tests. But when it comes to imaging, there's several different types of images we can obtain, and using our colleagues in radiology to read these scans per se, they help us identify different things. So if someone comes with abdominal pain, for example, an ultrasound could be ordered, and that could point to things like dilation of a duct in the gallbladder, or there could be the identification of some fluid. Ultrasounds are really good at abdominal organs like the liver. Not really the best for the pancreas, but again, it could be a test that's ordered by your practitioner that could lead us down a path to get more scans or more tests. Sometimes it's the first, sometimes it's not the first test that's done, but it is an exam or a scan that could be done that could kind of hint that something else is going on. The preference really is a CT scan. A CT scan is the main diagnostic image for diagnosing pancreatic cancer, and there's a special protocol we use called a pancreas protocol CT scan. These are good, these multi-phase CT scans, because they can inject this contrast, and there are different pictures taken at different times when the dye is injected into a vein that can show us if whether there is a mass in the pancreas, and if so, if it's related or living nearby blood vessels or different organs that can give us different answers to questions we're going to pose later. But CT scans are really good at finding these pancreatic masses. MRIs of the abdomen are also helpful. Then we get to PET scans. Now, different than ultrasounds, CAT scans, or MRIs, which are just black and white. Those are images that are telling us the size and the shape of different structures, different anatomy, different organs. PET scans are a little bit different in that they light up in areas where there's activity. Activity, though, could mean lots of different things: inflammation, infection, recent surgery, trauma, cancer. So you can see that PET scans aren't the be all end all to finding whether somebody has or doesn't have a cancer, but again, it could point us in the direction of either doing another test, a biopsy, or something of the sort. So they're all helpful images: ultrasounds, CAT scans, MRIs, PET scans, but the true meat and potatoes is a tissue biopsy. All oncologists will tell you that without a tissue diagnosis, a cancer diagnosis can't be made. So we usually have to take a needle and put it into an area where we see something that's abnormal, like a tumor. And one way to do that in the pancreas, where we see a mass, is through a test called an endoscopic ultrasound or an EGD, upper endoscopy. These are all relatively synonymous. They all mean different things, have different features. But a camera test where they go by mouth, put a camera in, kind of like a colonoscopy, but from the other end. So we're using a camera from the mouth into the esophagus, looking on an ultrasound at the pancreas. And if they see a mass, they can use that ultrasound to use a needle and get a biopsy. Basically, a biopsy is what we look at under a microscope. We take the cells, and a pathologist, the doctor that reads those cells, tells us whether the features are consistent or not with a malignancy or a pancreatic cancer, for example.